Patients expect instant access to healthcare, but the traditional appointment model just can't keep pace. How do clinics manage these needs without disrupting workflow, serving patients efficiently, and maintaining high-quality care? On the show today, THT Ambassador Nathan Moore speaks with Ben Hurst, the CEO of HotDoc, an Australian leader in patient engagement. And in this episode, we talk about the rise of on-demand care and its impact on patient expectations and choices, the need for modernising care delivery for faster, flexible patient access, and the role of technology in supporting practices and patients for a smoother healthcare experience. Collaboration starts with a conversation, Team HealthTech. Let's make it happen.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
G'day, Ben. Thanks for joining us today on Talking HealthTech. How are you going?
Very good. Hey, Nathan. It's a pleasure to be here.
I guess where I'd like to start, just for our listeners, who is Ben Hurst? Give us a little bit of a background of who you are, and then we'll jump into what you do.
Who is Ben Hurst? Okay.
Yeah.
Anyone who goes on my LinkedIn, they kind of know I've got a wacky pedigree. But to nut it out in about 30 seconds, I was a med student, went through med school, became a doctor, and about 4 years in, I was like, this is not for me. Went to New York for a couple of years, tried to write a book. That didn't pan out. And then on one of my final days in New York, I heard about this cool company called HotDoc, which was helping patients make online bookings. And that was my little light bulb moment. Came back to Australia and became a health tech entrepreneur. And 11 years later, here I am with a lot less hair.
Yeah, well, yeah, I'm a similar journey without the author, but there's definitely loss of hair from being a tech entrepreneur. I hear. So I guess, yeah, so we're 11 years later, but why don't we unpack a little bit more? I mean, HotDoc is your company, and what HotDoc is today is different to what it was when you sort of started it. So can you give us a bit of an overview of what is HotDoc and what is your mission? What are you trying to do?
Yeah, great. So our mission is to enable the best healthcare experience for everyone in Australia. And when we first started out, we focused on a little thing called bookings. And I always had in my head this vision of this poor young parent taking their sick little kid to the emergency department at midnight because they weren't able to get an appointment for the next day, and they're waiting in the waiting room for 3-4 hours. And for me, I wanted to really solve this idea of helping that young parent and helping other Australians just get that direct access to the schedule. And 10 years ago, there were about 10 players in this space. So we realized that although we were solving a good problem, lots of other people were trying to solve the same problem.
Yep.
So what we tried to do to make ourselves a little bit different was think about, well, what are other parts of the patient journey, which are pretty manual and crappy. And a few things that we saw were the recall process, getting a patient to come back for a preventative health like appointment. They'd often receive a letter in the mail and they chuck it in the wastebasket. So we thought, wow, we can digitize that. And then we looked at reminders, we looked at check-in, we looked at payments. And over time, we've kind of built more of a platform, and we call it a patient engagement platform. And in a nutshell, what that means to us is we make it easier for medical centers to run their businesses as well as effectively engage their patients, especially when they're outside the consult room.
Yeah, no, and I love how you're describing that you saw something you were doing, and then you were just that problem solution approach, saw other things that were happening, and how can we leverage our platform to better support these demands? I guess one of the things that this is sort of highlighting is that it hasn't been a static experience for you from where it was to where it is now. So yeah. I guess what are some of the challenges more currently? Because I was trying to do my homework before we met today, and again, my experience with HotDoc has been over the years, I've followed different things that have changed. What are some of the emerging challenges that you've had to adapt with? What are the things that are exciting you that you're actually helping accomplish your mission with your GP and your audience?
Yeah, awesome. So our focus over the last 10 years has been very much on that front office experience. And we haven't spent a lot of time thinking about, well, what do we want to do for GPs, and what do we want to do about how patients can maybe directly communicate with their treating team more effectively. And a new thing that we've really noticed over the last 3 years is the rise of virtual health providers.
Yep.
And what we've seen is that a lot of patients, especially young patients, they're starting to care much more about convenience than perhaps a really strong relationship with their existing doctor. And I think brick and mortar GPs, they do an amazing job on relationships. They don't always do an amazing job providing really quick access to care, especially for transactional type appointments. So there's a movement that we see around on-demand care where patients can get things like repeat scripts, referrals, results, medical certificates without necessarily having to wait 5-6 days to see the doctor, but also without necessarily seeing an anonymous doctor with whom they've not got a relationship. So our exciting area right now is trying to get bunch of GPs to start using HotDoc as a way to receive a request from their patient and either through text get back to the patient and maybe confirm their repeat script, or give the patient a quick call back, ideally on the same day, so that they're providing a really convenient experience in addition to one that is holistic and has that continuity of care.
Yeah, no, I really love that, because I think that's one of the things we've seen. There's telehealth virtual care providers in the market, but it is very much those transactional things. I love that you're doing this with the practice itself for their existing patients, but it does help them actually, fit in with that availability. It's just really, really exciting. I mean, from the patient side and patient experience, have you had much feedback with this yet? How is it being received? Is it, what sort of patient-facing stuff have you?
Yeah, so about 6 years ago, we built this thing called Repeats, and it kind of was what I just mapped out, a way for a patient to, without making an in-person appointment, request to the doctor via text, this is the medication that they want to repeat for, and allow the doctor to confirm it and enable some sort of transaction. This product was possibly a little bit ahead of its time, and it kind of became that like unloved stepchild product that just doesn't get much attention, much polish.
Yeah.
And interestingly, post-COVID, we start to see that the usage of this product, especially on the patient side, just increased 30% year on year.
Okay,
and we noticed like this is a change in consumer behavior. Suddenly, patients are they're unwilling to go through that inconvenience of making an appointment, finding a time in their day where they can drive out to the medical center, wait in the waiting room for something that's really basic. And we thought, here's something on the patient side that we should really start focusing on.
Yeah. And then I can see it's, that post-COVID, the convenience angles, the willingness to adopt. And I think maybe you're right that it perhaps was a little bit ahead of its time, but it seems like that time really is now. I guess it wouldn't be a health tech thing if we were talking some element of interop here. Like how do you guys actually integrate? Because it sounds like there's a lot of moving parts. And for those who potentially haven't tried it, the just simple bookings and follow-ups and all of those, like there's lots of moving parts here. Like how have you guys approached the interoperability with existing systems, and how have you tackled that?
Yeah, for over a day, like a lot of HotDoc's secret sauce has been having like deep integrations with some of the leading practice management systems, especially in the GB space, aka Best Practice, Medical Director, and ZenMed. This specific solution, the thing that we're trying to do is create a really simple queue-based way where a doctor can see, here are the requests that are coming through, and that happens for them on a HotDoc sidebar, which occupies a small part of the real estate on their PC.
Yeah.
And what we also do is we make sure that when they do something, they confirm that appointment, then they're able to write back that notes straight back into Best Practice. And we're also able to make sure that we can facilitate the payment in a way which links back to their existing systems. So, the doctor knows exactly how much they're getting paid. The clinic knows exactly how much they're getting paid.
Yeah, right. So even with that sort of sidebar access, you are still integrating with the systems. It's not they're going back into Best Practice to do it flows over.
Yeah, we're pushing information from the consult into best practice, but we're not taking any information out.
Yeah, nice. Really, really interesting. I guess from this, like, how with your sort of pilot groups and where you're sort of starting to see the traction, what is the feedback you're getting around efficiency and workflow optimization? Is this being taken up by patients? Are the doctors finding it useful? Like, what are you seeing with that?
Yeah, so the patients it's just happening organically. Like I think perhaps, as I said, we didn't have the most exceptional user experience on the patient side for quite some time because we just had other stuff to do. But what we're seeing is doctors really appreciate it. And previously, the way that the service worked is it sent the request first to the practice manager, and then the practice manager forwarded to the doctor. And creating that kind of like middleman experience, it did mean that the response time was more like, a couple of days. And we really wanted to bring it back to like same next day, which is sort of more aligned with patient expectations of their care. And so what we're finding is the doctors that are using it, initially it's a little bit of there's a little bit of apprehension based on the idea of them being more open to a direct conversation with the patient.
That pipeline,
And what we've done is we've said, look, this is a conversation that you can take in whatever way is right for you as a clinician. The patient is merely making a request that they'd like this more convenient style appointment. But if for whatever reason you think that's clinically unwarranted and it is better for them to have a 15-minute appointment, you can easily reject and then prompt them to make that appointment. So they still get to practice medicine on their own terms, but where they can and where it is cheaper and more convenient for the patient, they can provide that better patient experience.
Yeah, no, and I think that control piece is so pivotal. It's like you're saying that organic growth of them doing it. You see the demand, but at the same time, I can see the questions coming in their mind of, this might not be appropriate, or I do want to see them, or whatever. So no, I mean, look, we talked interop. I feel like the next thing we have to talk here is cyber and data security. So, I mean, this idea of the pipeline direct to the patient, I mean, there's potential things here. Like, how have you tackled it? Has there been any surprises? Yeah.
This particular solution probably doesn't necessarily add extra clinical sensitivity around the type of information that we're handling than our other solutions. Things like recalls, appointment types. Like, you are still, even indirectly, if a patient gets a sexual health related appointment type through HotDoc, like that itself. So we haven't done anything different in providing the specific solution, but HotDoc's always been very mindful about our security posture. We have a 4-person security privacy team. At the moment, we're working very hard. We're currently SOC 2 aligned. We're looking to get certified towards the end of the year, which I think any company that's playing in this space, especially as you start going deeper into things like results, we think that's just a kind of a need to have. So that's our plan. It's a big deal for us. We invest a lot because if patients can't trust us, if clinicians can't trust us to transact their information securely with the appropriate privacy considerations, then we're basically out of business.
I guess so. One of the things, I mean, just for those who are listening who aren't familiar with HotDoc, how do you guys approach the actual telehealth interactions in and of itself? Are you a one-stop shop when it comes to this stuff? Do you integrate with third-party solutions? Like, how do you tackle that? Because that interaction piece is obviously a key part for this.
Yeah, we do. So, the crazy thing about telehealth, especially if you compare with our US cousins, is that there's still in primary care a fairly not great uptake of video-based consultations.
Yep.
We see on our platform that around 10% of all bookings through HotDoc are telehealth.
Right.
But then over 90% of those are phone-based consultations.
Okay.
So given that behavior, we've really tried to make it the smoothest experience possible, where a patient can easily request, pay for, and the doctor's workflows are sort of not jarring in providing that service. What we'd like to see is a little bit more uptake of video-based technology. We do have our own solution. There are other great solutions on the market. So we can be a one-stop shop, but we also the best we can try and make it a seamless experience if a provider is using a different telehealth technology.
I mean, I guess one of the things, and clearly got a nice, well-established, scalable business. But I mean, one of the challenges I think is finding that balance between out-of-the-box experience and customization for bespoke needs where those arise. Like as HotDoc, how do you balance that? I've seen the specialist clinics that have their own niche, unique demands and things. Like, are you a rigid experience that you fit us? How do you approach that customization?
That's tricky.
Yeah.
So this is what I think a lot of businesses find. Early days, you just have to do whatever you
say
can.
Yes.
And you often find yourself doing the kinds of customizations that simply don't scale.
Yeah.
Because without customers, you're nothing. We're at a place, I think, in our development where, of course, for significant partners, if we're maybe talking to the government, if we're talking to, really large providers of services that are Australia-wide, we'll absolutely have that conversation.
Yeah.
But it's not something that we seek readily.
Yeah.
Because it's just really hard to cater for everyone's desired way of doing something. We try and make our technology as generalizable for our users, so that we can provide it to more people. But we often do encounter the challenge of being asked to do stuff that we're willing to think about, but not always willing to do it.
And I think it's very clear in what you've been able to accomplish and your wide deployment as well. Like, you have a product that fits a lot of needs and does meet the demands of the majority of people. But it's that tricky piece of it's great that you've pivoted past the point where you kind of have to say yes.
And I mean, look, if there are other entrepreneurs listening, and I'm sure there are, it's really important to just recognize you can't please everyone. Yeah. And saying no is so important, because if you don't start saying no, you sometimes forget, who your true customer is.
Yeah.
So our true customer is still very much the medical center and the GP. And so we will bend over backwards to try and, as much as possible, cater towards building something that really fulfills their needs. But, outside that area, we are a little fussier about what we do and what we don't do.
Oh, that's great. And sticking to that vision and strategy that will get you where you need to be.
Absolutely. Yeah.
Fantastic. Okay. So, I mean, one of the things we were just talking about, that we will bend over backwards for our core customers and what we want to do. Like, how does that process work? Like, what does your feedback and continuous improvement cycles look like? Like, I mean, emerging requirements, things like that for your core segment. Like, what does that look like in HotDocs? Like, how do you get that feedback?
Yeah, that's a big question. But I'll just give I'll give you a slice of it, because one of the things that customers or vendors can lose over time as they scale is that direct connection with their customer base. And so some of the ways that we've tried to work through that is have a really deliberate voice of customer program. And we have someone who's absolutely dedicated towards getting valuable signals from the customer base and collating in a way that decision makers at HotDoc can really understand. What do our customers truly want at scale? And two things that we've done that I think are maybe slightly unusual, but I would just recommend to any business that can, is we've got a customer advisory group and a GP advisory group, which is like just a group of individuals, practice managers, GPs, who are like very enthusiastic about new technology, doing things a bit differently, and great at giving prompt feedback. And so when we do have ideas or when we are trying to investigate an issue, they're often the first point of call, and we can get sort of like really helpful early insights before really doing some, more exploratory research. So I've just found that like such a good way to maintain that like direct connection with the customer. And it's supported all the other quality improvement endeavors that we undertake.
Yeah, no, I love it. And having that staged approach as well. So, the sounding board to and keeping that connection.
Yeah. Speaking for myself, a lot of my ideas suck. So it's great if I can just ask a very smart GP, hey, what do you think about this?
Yeah.
And they just shake their head and move on. It's a very valuable thing.
Yeah, no, that's fantastic. I love it. And like you say, I can see this being relevant. And it's something we see a bit where the disconnect starts to happen. And not necessarily even at a scaling company, just forget, someone steps out and has a great idea and loses that connection of what they were trying to do and what the evolving demands are. Because like we said at the beginning, this isn't static.
When you're starting a business, you're the chief of finance, you're the head of sales, you're the you manage customer support. So it's just part of the job. But as more people come on board and, you start to manage and, the org chart develops, it's not in the actual remit. And so having kind of almost a forcing function to make any company leader have conversations with customers is a very good thing, I think.
Nearing the end of it now, but one question I always like to throw to these really smart business leaders who do have your pulse on what's going on. For you, whether it be in your own product development pipeline or just more broadly in health technology, what do you see as some of the emerging trends that we just either need to follow or need to adapt to? And how is HotDoc positioned to either leverage or ride with them?
Yeah, cool. Great question. Could take this in lots of ways. Something that we think about a lot is the limitation of this thing called the 15-minute appointment.
Yeah.
Lots of healthcare interactions, they might take 26 minutes. They might take 1 minute. And we think that, and what we're seeing in the States and elsewhere is you've both got the rise of on-demand care, but you've also got the rise of creating a more direct connection with your treating team. So we think that's a big thing, and we're really keen to start thinking, well, what's the infrastructure that we can do to support that, to help patients and doctors transact sensitive information in a secure way, and also pay for it in an appropriate way. So some things that we're really interested in. I talked about on-demand care before. I think that's a big thing. I think another thing is that more and more patients are starting to want their own health information on that person.
Yeah.
And yes, we've seen some really good things with good ideas, I should say, with the My Health Record, but very difficult to execute. But that's something that I think patients are starting to think about more.
Control, yeah.
And something that I think we'll increasingly see over the next couple of years is innovation in the financial models around how patients receive care. Something that we know that the government's trying to introduce is kind of like a halfway capitation model where clinics start getting incentivized for handling more complex patients across their annual cycle of care. We think that's actually going to move more into the private sector as well, and patients will potentially start paying subscriptions. They're already doing that for sort of virtual type solutions, but I think that's going to become a more mainstream thing. So those are probably like the watch points for HotDoc. I think there are heaps of other watch points, but we're really interested in those unfolding areas.
All right. Well, look, by way of wrapping it up then, I mean, is there anything else you wanted to add that we sort of haven't covered that might be interesting to our listeners? Or
I'd say just if I was to think of the theme of today's conversation, it is just like keep talking to your customer and know who your customer is, because a lot of our ability to sort of forecast what we think is around the corner and try and build new stuff is through having those direct conversations. So that's probably my little piece of advice for those out there. But yeah, I think we've covered a lot of stuff today. So happy to wrap it up here.
All right. Awesome. Well, look, thank you so much for your time. Really do appreciate it. And thanks for joining us.
Likewise, Nathan. Thanks a lot. Appreciate it.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.